Yorkers who are living with mental health challenges. Let me just let that pass a minute. This is cutting right now. New York, guys. Instead of receiving the care and support that they need, too many people continue to be funneled into our city jails and trapped in a cycle of harm. More than half of those incarcerated in Rikers Island have a mental health diagnosis, and 1 in 5 live with serious conditions. Rikers is not a place for healing, and yet it has essentially been the city's largest mental health facility that has long been defined by crisis, violence, and neglect. When people are released, they're often left without stability or the services to help them. As someone with a family member who struggled with his mental health and who cycled in and out of jail and the justice system, I know how important it is to invest in proven mental health solutions and move towards finally closing Rikers. That is why the council, alongside our dedicated advocates and impacted families, have fought hard to secure major investments for mental health and public safety programs in this fiscal 2026 budget. Now, we need our mayor to implement these investments with the urgency that New Yorkers deserve. That is why we're here today to call on the administration to act now. To kick us off, it is my honor to introduce our leader of the City Council, Speaker Adrienne Adams.
Thank you very much, Deputy Speaker Ayala. And thank you all for being here. Good afternoon to everyone. I am New York City Council Speaker Adrienne Adams. As I always say, I do have the honor of leading our historic women majority City Council. We're joined here today, of course, by our Deputy Speaker Diana Ayala, Councilmember Carlina Rivera. I was looking for Councilmember Rita Joseph. We're still all in Dem Conference inside. I also want to acknowledge, of course, our great advocates, service providers, and New Yorkers whose families have been impacted by Rikers Island and the city's jails. Thank you all for your hard work, your voice, and your commitment to keeping our city safe. Our city's failure to effectively address the mental health crisis and urgently advance the solutions necessary to close Rikers has allowed the city's jails to undermine public safety and to be the largest de facto mental health facility. This is a failure of our city. Over half of those incarcerated on Rikers have a mental health diagnosis. When someone ends up on Rikers, their mental and physical health only deteriorates. 42 people, let me say that again, 42 people have lost their lives in jail-related deaths over the past 4 years, including 4 people since mid-June alone. This is an injustice that impacts everyone in the city's jails and in our communities, and we must correct it. We can break cycles of violence and trauma, which are further perpetrated at Rikers, by providing people with the mental health care they need and the interventions to lead productive and safe lives. For years, the council has implored Mayor Adams' administration to invest in mental health and safety solutions that are proven to reduce recidivism. We've urged the administration to fulfill its responsibility to support the programs that help advance the closure of Rikers as required by law. Yet, year after year, the administration resisted and repeatedly fell short of delivering the kind of investments New Yorkers need. As a result of continuous organizing by the very people right here today, advocates, elected officials, and people impacted by Rikers, we have finally successfully secured over $50 million in additional mental health and public safety investments within this year's city budget. Together, we fought for and finally won greater investments in justice-involved supportive housing, ACT and IMT teams, crisis respite centers, recidivism reduction programs, and other community-based services. These investments, which we have consistently championed and were a part of the Independent Rikers Commission's updated blueprint to close Rikers, are critical to our goal of keeping our city safe. reducing the inflated jail population, and ultimately closing Rikers for good. Now, Mayor Adams' administration must act with urgency to immediately implement these new investments intended without any further delay. The additional justice-involved supportive housing units must be created to address the housing needs that undermine successful reentry. The new ACT and IMT teams and step-down programs must be created to ensure New Yorkers in need of mental health treatment can access it. And previous investments that have been operationally delayed, such as outposted therapeutic hospital beds that are sitting empty and unused at Bellevue, must be brought into operation. Lives are on the line, and too many of our loved ones have already been lost because of a lack of urgency, mismanagement, and inaction. The city has a moral obligation to act urgently to confront the crisis. By recognizing and addressing how our mental health crisis is connected to housing opportunity, safety, affordability, and to the many other struggles New Yorkers face every single day, we can begin to advance a vision of true justice and safety in our city. There is no reason, and there is no more time to wait. We owe it to New Yorkers and to future generations to advance these proven solutions that can keep our communities safe. Mayor Adams, it's time to take immediate action to support our communities and the health and safety of all New Yorkers. Thank you.
Thank you, Madam Speaker. We will now hear from Darren Mack, co-director of the Freedom Agenda.
Thank you so much, Deputy Speaker Ayala. So thank you and thank goodness for the City Council for their unwavering commitment to real community solutions and erasing the stain in our city that is Rikers Island. The deadly overcrowding at Rikers right now is not inevitable. It's the result of Mayor Eric Adams' failed policies on top of years of divestment from public health. And there's no question that failures at the state level are contributing to the problem. But the city wants us to believe there's nothing they can do, but this is false. They have a tool that can directly use right now to potentially release hundreds of people to effective, evidence-based community programs. The 6A program allows for early release of people serving city sentences of a year or less. In response to another crisis, COVID-19, it was used in March 2020 to release over 300 people in less than a month. The results showed how much more effective community programs are than Rikers. Fewer than 1% of people released were rearrested for violent felonies and only 5% for any felony at all. That's much better than Rikers' average recidivism rate, with 33% of people returning within a year. The Board of Corrections, including members appointed by Eric Adams, have urged DOC to expand the use of 6A. But between May and July, as the overcrowding crisis was escalating, DOC used 6A in only 2 cases. The Board of Corrections followed up by making specific recommendations about how DOC could expand the 6A program and denying DOC's overcrowding variants. As far as we know, DOC hasn't even responded to BOC's recommendations, much less implemented them. Meanwhile, people are suffering and people are dying. More families are grieving, and our members who have lost loved ones on Rikers have said that each time there's news of another death at Rikers, it's a wound that is reopened. The time to act is now. We thank the Speaker Adams, the City Council budget negotiations, the Progressive Caucus, and the Black, Latino, Asian Caucus for securing these essential investments, and we look forward to working with you on the next step to get Rikers closed. Thank you so much.
Thank you, Darren. Thank you. We will now hear from Councilmember Carlina Rivera.
Good morning. I just want to thank you all for always being out here, no matter the weather. Realizing that if you think it's hot out here right now, can you imagine what it's like locked up in a cell with over 7,000 souls on Rikers Island? Good morning. I'm Councilmember Carlina Rivera. I represent Manhattan Communities. I had the honor and the privilege of chairing the Committee on Criminal Justice to learn from and to receive the guidance and really friendship of so many that are on these steps right now. I want to thank Speaker Adams. She has been a champion for criminal justice and public safety, and realizing that all of these things are intersectional and that we can fight for the incarcerated and those that are working on Rikers Island at the same time. We have taken great strides to improve conditions in city jails, protecting both staff and individuals who are incarcerated, and to improve transparency and accountability. But we need to do more to ensure that people who don't belong on Rikers don't wind up there in the first place. Over 7,000 people are locked up right now. That number has ballooned since Mayor Adams has taken office, most of whom are awaiting trial. And that creates terrible conditions. Imagine, you already have decrepit facilities, and then you are adding body after body and really creating an environment and a place where people cannot thrive, and it is very hard to believe in this idea of rehabilitation. That number, 7,000, is the result of the mayor's failure to prioritize what needs to be done to reduce the population as a public safety measure, along with delays in construction, which is going to prevent Rikers from closing in 2027, which is the legal mandate set forth by the council. That's unacceptable. A crucial part of closing these decrepit facilities is decarceration and ending our city's over-reliance on criminalization. We have to redirect funds to alternatives to incarceration, supervise release, reentry programs, and supportive housing. And that is exactly what Speaker Adams did. That is exactly what the City Council did, alongside the advocates this budget cycle, and we won. So you heard the data. 85% of people on Rikers are just waiting for their day in court. You heard the numbers. Over half need mental health treatment. Nearly half have a substance use disorder. Hundreds require daily medical care. 80% of women and gender-expansive people in jail are being treated for mental illness. And as you know, systemic racial inequities only deepen these harms. If we want a safer city, we must enact smart and sustainable policies that actually center support for our most vulnerable neighbors, and that centers rehabilitation over cruelty and punishment. This budget cycle, the council secured a comprehensive package of mental health and safety investments that are targeted, evidence-based, and will move our system towards care, continuity of services, and stability. These programs are designed to reach people before they cycle in and out of jail, to support those that are returning home, and to ensure that individuals with complex needs can access the treatment and housing that keep them and our community safer. I'm also working this month to pass legislation to expand access to supportive housing for justice-involved New Yorkers, because a permanent home and stable support are essential to stopping the revolving door of incarceration. This is how we build a responsible, sustainable path to closing Rikers. But these investments are only as strong as our follow-through and the partners who are supposed to meet us at the table. We cannot continue to warehouse people in a facility that costs lives and over $500,000 per person per year. It doesn't make any sense. Not spiritually, not mentally, and certainly not economically. This budget reflects the City Council's clear priorities. The administration must act with urgency. They must release these funds to providers and implement these programs without delay. Thank you. While
the City Council go back to attend the affairs of the city, I'm take over emceeing, and we have a few more speakers that's part of this coalition, this mighty strong coalition, to make sure that the investments are made in our city so people can have a dignified life instead of punishment. So the next speaker I want to bring up, representing the Fortune Society and the Independent Rikers Commission, put your hands together for Stanley Richards.
Thank you, Darren. And thank you to the council for choosing to invest in solutions that reduce mass incarceration, support community reintegration, and individualized stabilization. You see, we have much to celebrate in the FY26 budget, and we are so grateful to the City Council under the leadership of Speaker Adrian Adams for holding the line and pushing for so many critical investments in what truly keeps all of us safe. And for pushing those investments not only for this year, but for many years to come. You see, you've heard justice-involved supportive housing is about providing an opportunity for people to stabilize their lives. Post-incarceration, people suffering from mental illness could get the treatment that they need. Alternatives to incarceration is a tool the city has used for decades to safely manage those who we can manage in the community, to ensure that they get access to services and build the lives that they envision for themselves and for their family. And finally, for expanding community-based programs, including mental health programs and other services, to stop the cycle of incarceration. But we can't pause, we can't celebrate for too long. The time right now is for urgency and action. As you heard, we have over 7,600 people incarcerated in our New York City jails. And far too many of those folks are suffering from the kinds of medical and mental health issues that would be better off served in a hospital setting. You see, 57% of those who are incarcerated have a mental health diagnosis. 21% have a serious mental health diagnosis. Over the decades, Rikers Island has become the #1 source of mental health isolation and confinement, and we have to change it. So we call on the Adams administration to urgently open up the hundreds of beds in Bellevue, Woodhall, and North Central Bronx hospitals. We need accountability and urgency to prioritize DOC's staffing and crack down on the unnecessary and belated request for design changes. We are failing the most unwell people in our city jails. That does not make it safe for any of us. Instead, it really deepens the moral stain on our city. Everyone has heard the quote, "The degree of civilization in a society can be judged by entering its prisons." How will New York City be judged? Will New York City be judged as a place where change happens, where regardless of your criminal justice status, your humanity doesn't go away, where if you are in need of mental health care or substance abuse treatment or housing, that New York City is the place where you can get those resources so you can rebuild your life? Or are we going to be known for what is called the stain on the city of Rikers Island? The officers who work there deserve better. The people incarcerated there deserve better, and their families deserve better. And today we call on the administration to get stuff done. Thank you.
Thank you so much, Stanley. So next up, I'm going to bring is the Chief Operating Officer for the Institute for Community Living, Mr. Troy Boyle. Clap it up for Troy Boyle.
Troy just stepped away.
Oh, he just stepped away? Sorry.
Okay. We'll go to the next one.
Okay.
I'll go to the next person.
So we're going to bring up the Senior Director of Policy and Advocacy at Cases, Nadia Chayat.
Good afternoon, everyone. Mental illness is not a crime, but our city's policies treat people who are struggling with their mental health as though they deserve to be incarcerated rather than treated in the community with the supports and care that they need. These investments, particularly the investments in ACT or assertive community treatment and intensive mobile treatment teams, will help people actually get the mental health care, the housing, and the additional supports that they need to live safely in our communities. We know that these programs work. We have literally decades of evidence showing that these are the services that can decarcerate our city while improving public safety. This is just one example, one of our ACT teams that serves as an alternative to incarceration. Among people who enter the program on a felony conviction, 0 of them have a new felony conviction within the 2 years after they've completed the program. These investments are true public safety. This is how we support the health and well-being of our community and close Rikers. We're grateful to the City Council for their support, and we urge the Mayor to act quickly to get these dollars out so that we can do the good work that people need. Thank you.
Thank you so much, Nadia. And next up, we're going to bring on the Senior Advocacy Associate at Bronx Connect, Anthony Springer.
Great afternoon. I want to first start off with just thanking the City Council for their support and their partnership with in bringing these funds to our ATI coalition, and also to all the programs that are here that are doing the on the ground work. At Urban Youth Alliance, one of the things that we get to do, we are blessed with the opportunity to work with a population that is easily forgettable. It's easily forgettable for those who are not affected by it, those who want to be blind to it. But what we see is the opportunity for second chances. So with the ATI programs, what we have seen cure violence, go into neighborhoods and begin to bring down gun violence, where we have specific catchments that don't have a shooting within a year or more. We have seen mental health services come in and be able to bring down some of the issues that those who are incarcerated were dealing with. And we're seeing successes where people are not being reincarcerated. Well, in our organization, Urban Youth Alliance, we have over a 90% success rate with those who are coming into our program, not going back to the things that they were doing. And how do we do that? We do that by providing for the needs. We help them with finding jobs. We help them with acclimating back to society through our re-entry work. We help them with being able to find ways to use their anger or use the passion that they have inside of them. We do that by providing what they need, which is community support. In areas where you have youth and young adults and adults who don't have that community support, you see them running wild. But what we are able to do is we're able to not just touch the individual, but we're touching the families, we're touching the neighborhoods, and we're seeing growth through that. So what we're asking is not just for support for this year, but we're asking for continued support and getting ATIs and reentry funding where it needs to be in order to help our communities. So thank you.
And I think Boyle. Okay. Yeah, thank you so much, everyone, for being here. I want to thank the City Council, the Speaker, the Deputy Speaker, Fortune Society, Institute for Community Living, Urban Pathways, Cases, Bronx Connect, the Legal Access Center, Mental Health Project, so many organizations as part of this coalition that's actually for the first time bringing New York City at a point where we can actually get on track, where we're reducing the population on Rikers Island, closing the pipelines that's feeding incarceration, and do what must be done to finally remove the stain on our city, which is Rikers Island. Thank you so much, and we'll take a couple of questions.
Yes, 86% of females that are incarcerated are domestic violence, people who reported domestic violence. What is being done about getting them out? What is being done about helping them? And maybe looking at why their abuser is not in jail and they are.
Yeah, that's a good question. WCJA here? Oh. Yeah, that's a very good question. Some organizational partners like WCJA, the Women Community Justice Association, are focused on the women on Rikers Island and gender non-conforming folks on Rikers Island, and they would probably be best to answer that question, like what they've been doing. But we know what's been working. Alternatives to incarceration have been working. A person who survives domestic violence shouldn't be criminalized because of that, and that's something that we support as a coalition, and we definitely will work hand in hand with organizations, with the city council to make sure those women basically get the justice that they deserve. They need care, not punishment, and that's why we stand here today to fight for those investments in the communities instead of having people punished and unfortunately for far too many people losing their lives on Rikers Island. And the more that we invest, the more likely that the pipelines of incarceration to close. But we need this mayor to actually implement this plan. We got this plan. This doesn't happen overnight. We have a detailed plan to address all those issues, as well as the issue with regards to people losing their lives and being punished for things that shouldn't be punished for on Rikers Island.
Yeah, the last question I have. So you talk about those who lost their lives. What can be preventatively done? What is your proposal? And how are people even dying under supervision of the city?
Yeah, the proposal is investments. We need investments in the communities to prevent people from being incarcerated in the first place. All the speakers mentioned about the mental health situation that on Rikers Island, and unfortunately, for decades, the mental health infrastructure in our city has been almost non-existent. We see it on the news, we hear about it, from the news, and this is like a direct pipeline to Rikers Island. A lot of people who are suffering from a mental health crisis, instead of getting the care they need, they getting arrested and sent to Rikers. So investment is a big part of that, and that's something we have to continue to advocate for and continue to fight for.
Let me add too. There's a blueprint for what we do. The Lippman Commission put out the blueprint. We need to close Rikers Island. We need to open up the borough-based jails. We need to pull people out of the jail system who have mental illness and get them into treatment, into hospital beds so they can get the care that they need. We need to take people with medical issues and get them the medical care that they need in the borough-based jails or on the outposted bed. We have a blueprint to do it. The question is, do we have the political will? Do we have the commitment? Do we have the focus to get it all done? That's the question at hand, not the plan. The plan is clear. We have seen decades and decades of harm to people who are incarcerated on Rikers Island, people who work on Rikers Island, the family members who have to deal with the trauma and isolation of Rikers Island, and the communities who are sold a bill of goods. That if we incarcerate people, communities somehow become safer. At the same time, we've been divesting in community well-being, community individualization. We've done the things to create this. The question now is, do we have the will to do the things that will change it?
Yeah. Thank you so much, everyone.
Thank you.
Thank you.
Thank you. Well said, everybody.
I'm going to go and see Faisal.